I'm Dr. Sujata Bhatt, a senior consultant in the Department of Obstetrics and Gynaecology at Sector 27, Kailash Hospital, Noida. I will be talking to you about GDM or Gestational Diabetes Mellitus. What exactly is Gestational Diabetes Mellitus? It is impaired glucose tolerance test at the onset of first recognition during pregnancy. Worldwide, 1 in 10 pregnancies are diabetics, of which 90% are gestational diabetics. The incidence in India is almost 14%. And why is it important to know about gestational diabetes? Because it has its implications on both the mother and the baby in utero. Because as we all know, India is second to China and as the diabetic capital of the world. So already the pregnant women have a high risk factor for acquiring gestational diabetes. And we have seen more and more of polycystic ovarian diseases, a condition of insulin resistance amongst the adolescents group, who subsequently get married and get pregnant. So polycystic ovary itself is a high risk condition for diabetes, and as you all have seen, there are several women now who are with a high BMI, morbidly obese. They are also independent risk factors for diabetes, and of course a strong family history is an added risk factor for acquiring gestational diabetes and pregnancy. It has its implications on the mother, both during pregnancy and long-term implications like getting the non-communicable disease of diabetes and even cardiovascular problems because of that. While pregnant, what happens to the mother? The mother can have abortions. Then as pregnancy advances, the fluid inside can increase, which can cause premature labor, which can cause premature rupture of membranes. She is more prone to have preeclampsia or high BP in pregnancy. And when she gets into labor, she is likely to have a prolonged labor or an obstructed labor because of a very large-sized baby. And invariably, they end up in cesarean sections for delivery. And if at all they have a normal delivery, there may be difficulty in delivery of the shoulders of the baby. She may have perineal tears because instrumental delivery may have to take place. And subsequently, she may have severe bleeding post-delivery and infection. What about the implications on the baby? In utero, the baby can have congenital malformations. Diabetes can affect every system of the baby, the neurological system, the cardiovascular system, and even the musculoskeletal system. So the first 3 months are very crucial to make sure that the sugars are under control, because that is the crucial phase during the developmental stage. Subsequently, the baby can grow large in size, as we said, and then that is called as macrosomia, and of course leading to the preterm birth and thereby problems due to preterm. The biggest fear in pregnancy with gestational diabetes is a stillbirth in pregnancy. And since it is a metabolic reason, it will not be detected on ultrasound. No prediction can be done with an ultrasound or with CTG monitoring. It is metabolic, so you have to be very vigilant in controlling the blood sugars, because impaired sugars is what causes the stillbirth. When the baby is born, even in the neonatal period, they can have problems like respiratory distress syndrome, difficulty in breathing, because the lungs are not well developed in diabetic babies, and they can develop infection. They can have other neurological problems and mainly hypoglycemia soon after birth. So because of these implications, it is very important to screen every pregnant woman for diabetes in pregnancy. Now screening is a must with an oral glucose tolerance test in the first visit, and again at 24 to 28 weeks, and maybe even at 34 weeks if the growth scan shows a big baby. Screening with a random blood sugar or just a fasting and a postprandial is of no use. Oral glucose tolerance test is the gold standard for testing, screening for diabetes in pregnancy. And once it has been noticed that there is an impaired glucose, then it is managed in a multidisciplinary team. The endocrinologist is involved, and of course the dietitian too. And education of the patient and her family members so that they could recognize symptoms of hypoglycemia. And self-glucose monitoring is advised during the pregnancy subsequently. Once the mother delivers, it's not that the chapter is closed. Postnatal follow-up is very important, at least for a year, to make sure she has not gone into frank type 2 diabetes. Contraception is also advised and spacing is advised, and most important of all, pre-pregnancy counseling so that we are aware that sugars are normal before she plans to conceive again. So, in short, gestational diabetes in pregnancy is a very important condition nowadays, not to be ignored, and the importance of screening with an oral glucose tolerance test has to be carried out. Thank you.